We are going to scan this gentleman, age 48 years, and has been referred for that he is a cirrhotic patient to rule out any focal lesion in the liver. Whereas we will be performing the ultrasound of this patient, and you will see that you will get different findings. Now I will perform the ultrasound on this same patient, but in segments, because there are three rather, he is having three different pathologies. So let's start the scan. In the subcostal region we can see that the liver, this is the liver, this is the longitudinal of the liver. You can see the left lobe with irregular outer surface. This is the irregular outer surface. The echogenicity is diffusely raised, brightness is raised, and it is coarse. Texture is coarse, fine nerve, fits into the category of cirrhotic liver. This is the portal vein, and the portal vein at the level of porta hepatis measures 11.2. It's not dilated, it is patent, lumen is clear. Normal portal vein is measured from inner to inner border and should not exceed 13 millimeters. So and now the caudate lobe of the liver is, this is the IVC, this is the caudate lobe, this is the liver, this is the portal vein. So after this I will find, this is the transverse section of the liver. Now the right lobe of the liver. You will, in cirrhotic liver, you will see shaggy walls most of the time of that of the gallbladder. Here you can see that the wall of the gallbladder or shape of the gallbladder is very different. It's because of the fibrosis around in the parenchyma of the liver, whereas the gallbladder is okay, no calculus seen. Now here we see a cyst. This is a cyst in the cirrhotic liver. This area, this is the cystic area. Why it is cystic? It is cystic because you can see that there is posterior wall acoustic enhancement. This brightness, area of brightness behind the posterior wall of the cyst is called the acoustic enhancement. Solid, had it been a solid mass, there would have been no posterior wall acoustic enhancement, and secondly, it will not change its its cyst does not change its shape. Let's see, I'm going to keep trying, I will try to keep the cyst in the center, and I will try to give it a sweep. This is a magnified view. I will give a sweep to the probe to see whether it retains its shape or it changes its shape. Now you see that it has not changed its shape, though I have given more than 90 degrees sweep to it. It is thin walled. This is the posterior. Number one, thin wall. Number two, internally clear, no calcification, no septa, no solid element within it. Internally clear, thin wall with posterior wall acoustic enhancement, or this is the area of brightness. So this is a cyst in the liver, in a cirrhotic liver. Now you are seeing a shadow from the margin of the cyst. This shadow, this is called the critical angle shadow. This black line is the critical angle shadow, called the critical angle shadow, and between these two lines The bright area is the acoustic enhancement from the liver cyst. This is the segment 1 of this patient. Okay.